crucial that we can have any efforts also with the outlook to the future, to the next months.
And travel advisories are also impacting reporters who aren't able to get to the impacted areas, so the right information is not being disseminated. A lot of the information that is going out to the public is through social media, so as we put out those travel advisories, there's a real need to make sure that the newsrooms have the right information to know when their news reporters are going to be safe, and how can we get the right information disseminated rather than hearsay on social media.
Thank you.
And I think to Tim's point about short and midterm planning, a stakeholder community that needs to be engaged is the technology and telecommunications industries. More remote work could be a possible help in this instance. Technology can be the platform, but in an increasingly mobile-dependent world, we need to make certain that the telecommunication system can hold up to increased demand and pressure.
Yeah. Okay.
And I think we're concerned that the varying travel policies are going to allow corporations to apply inconsistently what those policies are, and it's just going to continue to aggravate.
You mean national policies?
Yes.
Okay. So an international approach would be highly desirable for companies that are moving goods. Real?
Yeah, so I would absolutely agree with the comments that were made by Chris and Jane and Tim in terms of how we would think about this moving forward. I think the other things that I would just add into that is that it seems to me that travel bans, one of the concerns with that is also in relation to not just the economic consequences, but your ability to actually respond effectively to the health issue to begin with. So that clearly has to be a factor that should be addressed in the context of analyzing what the right balance is. In addition, I understand my staff has told me that there is concern from the State Department and the White House about instability that would be essentially breaking out potentially in South and Central America as a consequence of this. And that's obviously another issue that we would want to factor into what would be the right balance for travel. But the final thing I'd just say is that in the United States, certainly we have experienced in the past political pressure to basically stop travel when there's panic in the country. And one thing that I think we learned from the Ebola crisis in particular was that stepping out early, communicating as effectively as possible with the public about what it is that you're doing, what informed travel should and should not be, and so on, and but also having a policy and establishing that policy early so that states and others can understand this is how we're supposed to be sort of communicating and working with the federal policy on travel on these issues. And I think internationally you might have a similar scenario in which the World Health Organization, UN, and others are saying this is what we believe to be the best practices for travel. That can be very helpful in trying to manage what the sort of public panic might be in that.
So you would advise a common international approach to this to the extent that that's possible, as opposed to country by country?
Coordinated is what I'd say.
Coordinated, okay. Yes, Adrian, and then we'll go to George.
Just heard from my staff, in fact, we need to differentiate between trade and travel, because what we're seeing now is we're substituting one medical crisis for another medical crisis. We can't get the precursors for our drugs shipped to manufacturing plants to be able to supply other conditions, not just this outbreak. And so we need to think about what is travel. Is it non-essential travel? Is it business travel? I think we have to be clear about are all countries created equal in terms of risk. We need to have real clarity of communication around that if we're going to maintain our medical supplies globally.
And for global business, for your company, where should that communication be coming from?
It should be coming from respected authorities. So it should be coming from CDCs, WHOs, departments of health, and then we should promulgate those as an industry, as we already do through organizations like International SOS, so that we have that risk clearly identified.
So you raised the question of essential versus non-essential. I just would ask the group, what is essential trade and travel? Do we have a common definition or even the beginnings of a definition of what should be essential trade and travel?
Well, it will depend on the context.
WHO, we
Has
should
a
use
list
WHO's
of
list.
essential
For
trade and
medicines.
travel. Yeah.
For medicines and supplies or for all trade and travel?
No, it's just medicines.
Medicines,
But,
okay.
I think it's the right question.
Okay. I'm sorry, George.
Yes, I've got some information from my side. It looks like some countries already banned travel. And it looks like also in China we have a few hundred cases and also have a dozen death cases. But look at the data so far we collected. Looks like, think about the 2009 pandemic, H1N1, and also Ebola. Of course, if you can stop everything, it looks like the numbers would decrease. But you have to balance between the trade, travel, economics and the social activity, everything together. So in my opinion, think about H1N1 and Ebola. Maybe risk communication and public understanding the whole situation is more important than the ban of the traveling and everything. So this is, I would agree with Matthews, spread the knowledge to the public by mobiles, all these accessible device.
Thank you. Sophia,
did
you want to comment on that? Sophia
yeah,
and Brad?
I want to agree with that.
Okay.
And my staff have advised me that basically the level of support for travel restrictions is somewhere between 57 and 90%. Now, we all know politicians will be influenced by the general view in the community, but we can use that in a positive way. The truth of the matter is, if we find ways to retard spread, and if we can work with people, so what we're doing is, one, consistent with meeting their concerns, but we do it in a way that actually meets the science need. And we have done this with Ebola, we've done it with flu. So we've got history here, but we need to do it in an orderly and in science-informed way.
Okay, thanks, Sophia.
Thank you. And just a note that the UN is now concerned that the travel restriction is now impacting countries that have not even reported any cases, and recommends that member states actually follow the WHO guidance, and that means not to implement a travel ban. I think it goes back to the communications point that has been made around the table about the informed travel, et cetera, et cetera.
Thank you, Brad.
Yeah, we've reached a point where travel discussions and bans, whether it's personal or commercial, is affecting supply chain, and there's fear and panic about ships and coming into docks and supply. So it's starting to interrupt supply chain. So we have to just be cautious at this point in the time of the crisis that it's not just about travel, because now it's spreading to supply chain issues, because countries or even companies are saying, don't let that ship come into the dock because it's coming from an area that's, right. I think, so we can't be siloed in our thinking about, oh, it's just travel ban right now. Right. So it's starting to affect a broader part of the crisis.
So for those of you who work in the global supply chain, what kind of strategic interventions are going to be necessary to keep trade and travel going? Are we going to need to have government bailouts of companies, or are companies going to be able to make it through this crisis? For example, Lufthansa or others in your industry, are we going to need subsidies, liability, remediation, countermeasures? What's it going to take to keep Lufthansa flying?
I mean, first of all, it is really that we have open communication, that we try to convince, as Sophia said, governments not to ban each other, especially if it's countries that are not affected. We realized it. I take again the example from the SARS crisis. Hong Kong was heavily affected. We had good communication with the government there, with the CDC, and we could find a way to maintain operation, although it was economically a nightmare, 20% booking figures in the planes for certain periods.
So you're flying planes with 20% bookings?
Yes, but we kept flying. Okay, that time it was one destination. If it's worldwide 20% booking figures, we have to adapt the network. We will not maintain this for several weeks, that's the case. But that's why it's so important. And once again, with Sophia, we have to spread this out clearly. Countries that are not affected should be served on a normal basis. Countries that are affected should be served on an adapted basis, what is necessary, but still should be served. And we need a clear and open communication. Jane mentioned it as well. What is essential, what is non-essential travel? We have to clarify this. Otherwise, if we go down to 20% bookings over a long period, the company will run down. That's a fact.
I should just say on this chart, this is the information that we have, but I think most public health experts presume that there are cases in many more countries. So I think it would be false reassurance to say we can keep flying to this country because there are no cases. We don't know that there are cases, but we believe that there are cases. They haven't been detected yet. Yeah, Tim.
Yeah, I think it's really important to have a plan that identifies the dozen or 2 dozen trade and travel sector players that need to get together and agree on how they're going to have a collective business continuity. And it's the sort of thing where you need the leadership of those industries to gather, and they have to come together in a way which perhaps is unusual, but where there should be some government incentive to collectively organize and perhaps help to buffer the crisis with whatever fiscal measures might do that collectively to make it clear that on the imperative for keeping the system moving. But I want to suggest that it's really important that that be done in a pluralistic way rather than a singular effort across all sectors. Because if there's some sense that there's a UN institution that can do all of this, then I worry we're suffering from a delusional disorder on the power of the UN. It's really important to get those industries and their trade associations and an efficient leadership established which is decentralized but has a collective responsibility and accountability. And that needs to be supported by the public leadership.
So government leaders
Yes.
should be behind that. Yes, Latoya?
I agree with that 100%. And looking at your business continuity plans and getting together with industries that subsidize what your company is doing, and using the government as a alternative or another method of understanding what's going on and utilizing their leadership, have it decentralized, because that way no one particular industry is getting more than the next. So that way it leaves everything even across the board.
I see. So industry should be, the travel industry should be broadly part of that
We need to be
discussion
broadly
about
a part of
coordinating
that.
international approach, okay?
Right.
Yeah,
I think we also need to think about the healthcare workers who are traveling to some of these countries on a normal basis. A lot of these healthcare workers from different hospitals that are going to provide aid on a normal basis for different diseases. Are we now helping them understand how to take care of those patients in those countries? And how do we make sure that we're not causing panic among the hospitals and other healthcare organizations like Doctors Without Borders or various hospitals that have global efforts to ensure that they're not causing panic and pulling their teams away from those countries that may really need them right now?
Okay,
And
Sophia and then Chris. Or Latoya, did you want to jump in?
Jump in on that, and to utilize companies such as ourselves that have a vast healthcare system within our properties. So that's one thing we've done before. We have actually mobilized. We have nurses and nurse practitioners that work around the world for our company, and we can mobilize them and assist in, providing care.
Okay, Sophia?
Thank you. I just wanted to get back to your point about the non-reporting, and in some instances it could come down to capability and capacities of the health sector in the particular country concerned, and I think this is where an organization like the United Nations can be of help by providing framework guidance that others could use, and to help in the deployment of health professionals to those parts of the world that are lacking in the capability. But ultimately, governments have to be capable of asking for help and also to take action in themselves. The UN, I agree with Tim, can be there and in a supportive capacity to coordinate, to assist, but it will run into the question of sovereignty every time. And so governments need to be empowered and capable of helping their citizens.
Thank you. Chris?
Thanks, Tom. 2 points I'd like to make. One is to just second the comments that Adrian and Brad made about the need for us to distinguish between travel and trade, and to really begin to focus, especially given some of the projections of 2 and maybe 20 million cases within 3 months, to really define what is the critical part of the global supply chain infrastructure. We won't have the drugs if we can't move the active pharmaceutical agents from one place to another. We really need to focus on what will it take to keep that global logistics infrastructure running. We've heard already that some workers are not willing to come to work because they're not confident they'll have the personal protective equipment. They need to be prioritized in terms of access to the countermeasures, et cetera. And that, I think the travel issue, we shouldn't use blunt instruments, have bans when bans don't work, make sure people are making informed decisions. If we go to 2 or 20 million cases, people are going to make decisions not to travel. And so we need to really focus on the critical infrastructure necessary to move health commodities, to move fuel to places that are going to require fuel to keep their hospitals running, to keep food moving. There's a whole complex set of issues in a highly interdependent world on supply chains that are just in time. We need to think about how much flex there is in that just-in-time supply chain system and make sure it keeps running. I think it's going to take specificity, and it's going to take knowledge that only the private sector has. The UN can play an important coordinating facilitation role, but the companies know where those commodities are, where they move, how to move them, and that's where